So these are questions usually posed to me on social media. First question I get asked a lot, are you a real doctor? You can't blame people for asking you this question. You open up TikTok, what's the first thing you see? Maybe the neurologist, or the psychiatrist, emergency physician, or God forbid, the nephrologist. Totally fair to question medical credentials when you see this. Of course, the truth is, yes, I'm a real physician. We all know this, technically. It's just there are other doctors that are like more of a doctor than me. Here, this is an academic conference, so I brought some data. Let me show you. Bear with me here. So yeah, this is just my general, like my medical knowledge over time. My last day of intern year, that was the smartest I've ever been. And I had to leave the hospital and begin ophthalmology, and I kind of forget most of what I learned. But this is not like unique to ophthalmology. If I was an orthopedic surgeon, like it would just be the same thing, right? This is kind of the nature of medicine now. And so people find out I'm an eye doctor, they're surprised, like, really, wait, you're an ophthalmologist? But sometimes people try to spell this on social media, so it's more like, wait, you're an ophthalmologist? Okay, it's a hard word, I get it. People don't know what kind of doctor I am because I play all these different doctors on social media. And I do want to give a shout out to YouTube, because YouTube has started doing something I love. You can apply to have a label on all your videos that says that the information provided is coming from a doctor licensed in the US. So now, you go to my YouTube channel, and you see a video of me zipping myself up as Jonathan in a piece of luggage. You could be rest assured that this information is coming from a doctor licensed in the US. So here's another question I get asked. Okay, you're an ophthalmologist. How do you know so much about all these different areas of medicine? Let me let you know a secret. I don't. All right? Let me bring back this graph here. Let's blow this up right there. That's where I am right now in my career. All right, the area under the graph right here, that's all the medical knowledge that I use in my skills. I'm pretty good, surface level, you know. But here's probably the question I get asked the most over the last few years. What do you have against United Health? All right, so we got to go back in time a little bit to answer this question. So, third year of med school, that's when I started Glaucomflecken. And I was going through rotations, and you know, everything was going great. In fact, my pediatrics rotation was at Maine Medical Center. I was at Dartmouth. You got some people from Maine here. Yeah, it was fantastic. And that's actually, that rotation was the origin of the video you saw before I came out here. Because it was a very difficult rotation, like academically, but also physically. I like wrestled a couple toddlers during that rotation. Very strong, very strong. So it's just like nonsense. People are saying that pediatrics is easy. What are you talking about? No, this is very challenging. So I was going through my rotations. I figured out I wanted to be an ophthalmologist eventually, and then at the tail end of my third year, I woke up and I found a lump in my testicle. And I was actually like top of my class. I knew my testicle was not supposed to grow another testicle. Like I knew that. Quickly diagnosed with cancer. And as we all know, if you catch testicular cancer early enough, like it's pretty easy to treat. But I just had an orchiectomy. And so physically, like I was fine. A little off balance, but I was fine. But emotionally, like this was a huge deal for me because I was in my mid-20s, never been sick before in my life. All of a sudden I had this disease I associate with people 3 times my age, right? And the thing with cancer care is like there's a lot of attention paid to like little kids, right? And older adults. There's a huge group in the middle that really feel forgotten. It's just a very isolating, kind of lonely experience being a young adult with cancer. It's hard to find people who are going through a similar experience. And so I dealt with this really the only way that I knew how at that point in my life, by telling jokes. I started writing stand-up comedy material Talking about my experience as a cancer patient, also my experience as a med student, like Krebs cycle jokes, they never went well. But it helps. It taught me the value of humor as a coping mechanism. Because when we're faced with things in life beyond our control, you get sick, a family member gets sick, a pandemic hits, you get your dream job, but they have United Healthcare insurance. You feel like control of your own life is kind of taken away from you. And what humor does, it allows you to reassert control. You take that thing, you make it yours again, you present it to others, you share a laugh about it, but it's on your terms. That's why it's such a powerful coping mechanism that most of us in healthcare use. So it helped me. I had my surgery, graduated med school, went on to residency at the University of Iowa. Shout out, Hawkeyes. And 4 years after that initial cancer diagnosis, I found a lump in my other testicle. I learned two things that day. Number one, I was one of the less than 1% of people with testicular cancer who get a primary cancer in the other testicle. It's extraordinarily rare. The other thing I learned is that I am really good at finding my own testicular cancer. Could make a second career out of doing this. The weird thing as an ophthalmologist, I get it. It is all just balls, so it's kind of leg. I don't know, that makes sense. This second time around, though, was much more devastating because I had to have a second orchiectomy. So, were we done having kids? Do I need to bank sperm? What about, do I need to postpone graduation from residency? What about hormone replacement therapy? And can I just say, as someone who gets a lot of testosterone injected into my ass cheek every 3 months, big fan of gender affirming care. It just helps me feel like myself. So, this was actually kind of a low point in my life. And cancer the second time, having to deal with all these things. And I couldn't exactly do stand-up comedy because it was in Iowa, not exactly a stand-up comedy hotbed. So I turned to social media. I started a Twitter account. I called myself Dr. Glaucomflecken, and then I told painfully specific ophthalmology jokes to an audience of about 6 people. This is one of my first jokes. A Drusen researcher just called another Drusen researcher a pseudo-Drusen researcher. Don't pity laugh. This kills in ophthalmology conferences. It does. But I want you to look at the likes on this. Look at that. 8. This is my most popular joke for 8 months. I very quickly realized if I wanted to actually grow an audience doing this, I had to expand into other areas of medicine. So I did. And by the time I graduated residency, I had 10,000 followers on Twitter. It was very exciting. This officially made me the 3rd most famous ophthalmologist in human history. Right behind Kentucky Senator Rand Paul and Syrian dictator Bashar al-Assad. I was number 3. So I graduated residency, had my orchiectomy, and now riding a bike has never been more comfortable. I think that's my last testicle joke. Moved on to Portland, Oregon, where I began my career in private practice ophthalmology. And life was really good. I was building up my practice. We had 2 beautiful young kids, and things were going great. And then 2020 hit, the pandemic. You ever wondered, how are we going to explain this to future generations? We all kind of know what's happening in this photo, right? I guess not all of us decided to cut their own hair with a beard trimmer live on TikTok. I did. But, we closed down our practice, had to let everybody go. It was awful. And there were a couple of moments when I thought, actually, that I might get redeployed to the hospital to help. You know how bad a public health emergency has to be? For critical care physicians to be like, get some ophthalmologists. Gotta do something. That didn't happen, so I spent my time doing something that was just as important as saving lives during a respiratory pandemic, was making TikToks. And then Mother's Day 2020 came around. We had a wonderful day in the backyard. We had a water balloon fight. I was the kid's target. And these were almost the last photos that were ever taken of me. Because later that night, 4:50 in the morning, my wife woke up to the sound of me kind of gasping for breath. She thought I was snoring, tried to nudge me, get me to wake up, but I wasn't waking up. So my mom's not in medicine, so she didn't quite know what was going on. So she called 911, and they asked her 2 questions. They said, "Are you able to wake up your husband?" The answer was no. Is he breathing normally? The answer was no. When the answer is no to those 2 questions, the decision is to do chest compressions. So that's what she did. I was having agonal breaths. I was having cardiac arrest. And then she did 10 consecutive minutes of effective chest compressions. People wonder why it took so long. Well, this was the height of the pandemic, right? The first responders, they had to protect themselves. It was chaos. We didn't have any protection. We barely had PPE. And so they had to protect themselves before coming to the house. Eventually, they busted through my back door. Never been so happy to have structural damage to my house. And they came upstairs, and they said, my wife was working so hard on chest compressions, her feet were flying off the bed each time. They took me downstairs. They shocked me 6 times. They gave me a bunch of medications. I'm not sure what they are. I'm an ophthalmologist. They got a rhythm back, put me in the ambulance, took me to the hospital. I was pretty much immediately admitted to the ICU where they did targeted hypothermia treatment, and we waited. Really, my wife waited. This was the longest 24 hours of her life. Which is why when I tell this story, I always talk about the co-survivors of medical trauma. I went to bed one night, I woke up in the ICU 2 days later, I didn't have any underwear on, I didn't know what the hell was going on. She lived through every single second, agonizing second. And it doesn't take much to just show, and I feel like pediatricians, you guys, you work sometimes with like child life specialists, and so you kind of get this more than other medical groups. But often these types of medical traumas are just as, if not harder, on the people around the patient, right? We don't see that side of things before people get to us in the hospital. And just recognition. I understand this is really hard for you. Like, do you need anything? Someone to talk to, warm blanket, something to drink, something like that. That's something that's just enough to like really make people feel differently about the healthcare system. So as grateful as I am for the people that took care of me in the hospital, I'm just as grateful for the people that showed my wife that compassion along the way. The 911 dispatcher who calmly walked her through how to do CPR on the fly. The first responder who was going up and down the room, up and down the house, the stairs, is letting her know what the next steps were. The paramedic who gently closed the door to my kid's bedroom so they wouldn't see me. My ICU nurse, Roger, during the last one. He's the first person I remember waking up in the ICU. He was facilitating FaceTime calls with me and Kristen. And he was also the first person through the cancer diagnosis, through the cardiac arrest, the first person to ever ask Kristen how she was doing. So I woke up, I had all the testing in the world, as you can imagine. No COVID, it was nothing, my cardiac MRI, all the testing was negative. We still to this day don't really know why I had a cardiac arrest. But one of my first memories is sitting on the edge of my bed in the ICU, and I'm handed a box. I open up the box, and I see a picture of this gentleman right here. If you don't know what this is called a life vest. This is an external wearable defibrillator. It's an electric bra, folks. That's what this is. See, normally, someone like me has an out-of-hospital cardiac arrest. I just get a defibrillator right there in the hospital before I ever go home. This was COVID. All that surgery got shut down. Right? So I got to wear this thing for like 2 weeks at home. And don't get me wrong, the man looks great. He does. For an electric bra model, he's fantastic. He's also 85 years old. And I'm sitting there as a 34-year-old, like, well, this clearly isn't supposed to happen to me. Right? It's one of those reminders, you know, that this isn't you. But I'm a good patient, so I wore my electric bra faithfully. And now I know how amazing it feels to take a bra off and do a more. Wow. The other piece of discharge instructions I was given is that I wasn't allowed to drive for 6 months after this, which I thought was kind of curious because I was able to do eye surgery. So I don't totally different. But we were in this weird situation, right, where I could go to work, but I couldn't get myself to work. So my mom came and lived with us for like 6 months. And she would take me to work in the morning. She'd pack a lunch for me. Drop me off at my job where I do a bunch of complex eye surgery. And then in the afternoon, she would pick me up. She had a snack waiting for me in the car. Amazing. Yeah. Thanks, Mom. So anyway, I went home, and you know, a lot of people feel like that's the end of the story, but there's so much more to recovery from something like this that happens after the hospital. And there's a lot of fear that we experience as a family. I was afraid of being alone. I never would have come to a place like this to do this because I'd have to be in a hotel room by myself. Never would have done it. I would wake up in the middle of the night to find my wife checking to make sure I'm breathing in the middle of the night, checking to make sure the kids were still breathing. Even though they were fine. And I had to go back to the same hospital to get my defibrillator placed. And I was a nervous wreck. I was terrified. I remember sitting in pre-op, and my surgeon walks in, and he sits down in pre-op. That's when you know shit's about to get real. When your surgeon sits down in pre-op. He says, well, when we put the defibrillator in, we have to check to make sure it works. So we have to stop your heart to make sure that the defibrillator fires. And I lost it. I was like, do you know how hard my wife just worked? I was a mess. And we got through the consent, and I will never forget this. They were wheeling me into the operating room, and I had tears streaming down my face. It was in that moment the anesthesiologist looks at me and says, are you nervous? In his defense, did the most compassionate thing any physician's ever done for me. He gave me all the percent. I guess it works, because I'm still here. The biggest challenge we faced came a few weeks after. That's when the medical bills started coming in. And it's never just one bill, right? That's way too convenient for our healthcare system. No, it's multiple bills, different places, different people. Sometimes it's an explanation of benefits. It kind of looks like a bill, but it's not a bill. Sometimes you get a bill for a bill you've already paid for. And as I got all this stuff together, I realized there was about like $20,000 that my insurance company was supposed to cover that they weren't. I knew that wasn't right. You see, what happened was the ambulance took me to an in-network hospital, but the people that took care of me in the hospital were out of network. I didn't check first. That's on me. It's a toll-free number on the back of your insurance card. There's really no excuse. It was a 9-month battle with them before they finally covered what they were supposed to cover. It was awful, and it changed my comedy. It was around this time I started making videos about the U.S. healthcare system. You know, because the people who are in the hospital, our patients, come home, they're supposed to be putting the pieces of their lives back together, but we drop the healthcare system on their head and say, deal with this. It's awful what we do, right? So I was like, I gotta do something about this. So I started making these videos, and this is just one of the examples of one of these healthcare videos. United Healthcare, you're welcome for me answering this call.
Hi, this is the pharmacist. We have a customer here trying to fill their generic asthma controller medication.
Oh, that's going to be a problem. Yeah, we don't cover the generic anymore, only brand name.
Why? The generic is so much more affordable.
Well, the brand name manufacturer gave us a bunch of money, so we choose them.
You get a kickback? That's why you're charging people for an expensive medication?
No, we're simply choosing a brand name medication to include in our formulary with the understanding that whoever makes that medication will give us money in exchange.
That's literally a kickback, which is illegal.
Why do people keep saying that as if laws apply to the U.S. health insurance?
All right, I'll call the doctor.
Pediatrics?
Hi, pediatrics. This is pharmacy.
Pharmacy! It's so good to hear.
Insurance requires a brand name for that asthma prescription.
Kickbacks?
Yeah.
Okay, let's go with Flovent.
You got it. Thanks.
United!
Okay, we're gonna change it to Flovent.
Oh, that was last month's brand.
You just have a dartboard with Q-Bar on one side and Flovent on the other? All right, let me call the doctor.
Pediatrics?
They won't cover Flovent, only Q-Bar.
Oh, dartboard?
Yeah.
I'll change the order. United!
Okay, we changed it to Q-Bar.
Ooh,
What now?
we're gonna need a prior authorization.
I had to learn what Q-Bar is. So I do my research. All right, so I started making these videos. Every time I put out one of these healthcare videos, the response was incredible, right? It was millions of views, but also it was the comments. Thousands, sometimes tens of thousands of comments, all people talking about their own experience in the healthcare system. It's like I opened up the floodgates, and everybody had a place to go, finally, to vent their anger about healthcare. It just so happened to be my TikTok comment section. So I realized, like, number one, I got to keep doing this. But also, there's a real impact that social media can have when it comes to advocacy. Right? In order to make change happen in healthcare, on a basic level, you got to know there's a problem. Clearly, the public knows there's a problem, right, with the reaction to these videos. But the second thing is you got to know what the problems are. And that's where the disconnect lies between what we all know in this room and what our patients know. We know, and oftentimes we try to shield patients from these problems, right? But if we can instead start talking about it, there's a lot of people already doing this, you know, making content, putting it on social media, talking about what the pain points, what the roadblocks that we experience. I want to shout out Dr. Elizabeth Potter. You guys know Dr. Potter? You've seen this stuff? Incredible advocacy. All what she's doing, it's amazing. She's just filming herself doing a peer-to-peer review and letting it speak for itself, right? She's educating, she's showing people, look at this is what it is. Not necessarily offering up solutions, although she is doing that too. But you don't have to have the answer for how to fix healthcare. All right, but if we can just show people what the issues are, more people are educated about U.S. healthcare, then we can create more momentum to change things. So don't overlook the impact that just educating people can have when it comes to advocacy. It's huge. Yeah, thanks. So, I would love it if all of us could like go and be on social media, creating content, talking about prior authorizations and Medicaid, Medicare, and all these things, the healthcare system. But unfortunately, now our attention is being split to something that I think, honestly, might end up being even more diabolical, and that's misinformation, right? We have the highest levels of government undermining everything we do, undermining our expertise, basically the basis of what we are have built the profession of medicine on, which is just patient care, right? Telling people not to trust us, not to value our expertise. And it feels kind of like preaching to the choir here, because like, I'm talking to a room full of pediatricians, like, yeah, we've been dealing with misinformation. It's kind of like this meme, right? It's like, this is really? Like you're just now getting here? Like, what? This has been like the last 50 years. But it is true. It's not, now it's really starting to affect like the basis of what we do. And it's affecting every single specialty. I remember the first bit of misinformation that I debunked on social media back in 2016 as Glaucomflecken was a Facebook group that advocated for urine therapy. They were using urine eye drops to treat like conjunctivitis, styes, whatever. And I'll tell you, it felt like a low bar. Like it doesn't require a lot of expertise to be like, don't do that. But just since then, since 2016, it's just gotten so much worse. And it's just escalated over the past year. And now we know the effect of misinformation on social media. It spreads much faster than factual information. And most people, not most people, but maybe now, this is back in 2021, so over the last few years, a lot of people are getting their medical information on social media, on TikTok, before consulting with physicians. And so this is why it's so important that you mentioned all the pediatricians on social media. I love that. I love seeing all of you out there talking about these things, giving accurate, evidence-based information. By the way, I highly suggest doing it in story format. People love stories. That's all my content is, just stories. I'm just tricking people into learning different things within the story, right? But I understand the hesitation that a lot of people feel toward creating content, right? What about the negativity? What if I say something stupid and go viral and now I have like 1,000 one-star reviews on Google? What if the hospital, doesn't like what I'm saying? And so I want to try to just take a moment to put those fears to bed a little bit, because really we need to meet people where they are. We do. We're already doing it in the exam room. All right, we're just moving it over to social media. All right, but how can you do this while still maintaining your integrity and not saying something that's going to undermine people's trust in what we do? That's so important right now because everybody's trying to undermine trust. All right, so 3 things, basic. No HIPAA violations. All right, obviously we know that, but it goes beyond that. I would say keep social media life and your working life, your clinical life, as separate as possible. Don't make content in the hospital, at your place of work, unless you own the clinic or something, right? But no badges, just keep it separate. I have 2 different companies. There's Glaucomflecken, and then there's Dr. Will Flanary, I Health Northwest Ophthalmology in Portland, Oregon. I don't mix the 2, guys. I think it's really important. Obviously, no misinformation. We know that. That's what we're trying to avoid. But that means making sure that you know what you're talking about, right? Make sure you're using up-to-date information, and obviously we can do that, right? We have that expertise. And the biggest one, especially for me, is don't punch down, right? Someone who talks a little bit more off the cuff and does lots of jokes, you'll notice in my content, I never have patient characters, never. Because it's so easy to be portrayed as someone who's a doctor punching down at patients, making fun of patients. So you cannot do that. That's the fastest way to undermine trust in what we do. Right? And then it's so much harder to build back that trust, right? So it's okay to, I can make fun of you guys. You can make fun of me. It's great. I love doing that. Right? We love doing that to each other. All right, but it can't go down. So here's an example of a post a few years back from somebody. Every clinic needs a non-compliant stool where non-compliant patients have to sit wearing a hat that says, "I know more than my doctor." This is punching down. Who in their right mind would say that, "Oh yeah, it was me"? Everything I'm telling you not to do, I've made the mistakes, you guys. All right? I'm trying to help you avoid that. But even if you think this might be funny, it's not a good thing to put out on social media. All right? So just be very careful, especially when you're telling stories and talking about patient care, clinical care. You have to be very careful about that. Bottom line is, though, your voice is not just what you're using it for now, which is communicating with patients, families, all right? It's for educating the public, and we have to do that now more than ever. Social media, you don't have to dress up in costume and record yourself alone in your bedroom. Like, it helps. Like, there's lots of ways to do social media, right? You don't have to have 1 million followers, you don't have to have 5 followers. Like, just do it. Just get out there and to the best of your ability. And it's a great creative outlet as well. And I mentioned no punching down, but I promise you can absolutely punch up.
Timothy!
Yeah, Max, what's up? I've been workshopping some new science.
That's a new combination of words.
Sure, what do you got?
What do you think of Tylenol as a cause of autism? I don't know. Kind of sounds like something that could cause autism, you know what I mean? No, I don't. Well, it's either Tylenol or those nerds gummy clusters.
You just have a random list of things you think causes autism?
No. It's written in crayon, isn't it? Well, can you prove Tylenol doesn't cause autism? That's not how science works. As HHS secretary, I'm pretty sure I decide how science works. You can't claim something is true, then expect others to prove it isn't true. The burden of proof is on you, the person making the claim. Nuh-uh. Regardless, there was a sibling-controlled 2024 study of over 2 million children in Sweden that did not find a link between acetaminophen and autism. And that was a high-quality study. Well, I don't like that study. Why? Because it doesn't give me the result I want. Again, not how science works. It does now, Timothy. And by the way, if there's anything you want from science, let me know. I can make it happen.
So, I want to thank you. I want to thank you so much for being here, for wearing your headbands. I think this area here is like a requirement to wear headbands. And so thank you all. And also, I just want to thank the AAP because protesters outside, we see every day it seems like. I was hesitant to give my slides like too early because I don't know what's going to happen like tomorrow, right? To talk about it. And so the leadership that the AAP in particular, but all of you, because it comes from you guys, right, is showing in the face of all this adversity. You're setting the standard, you really are, for how to push back. And so, thank you for that. We need more of that. And thanks for inviting me. Appreciate it.